Assalamu alaikum. Predentin is not a reliable barrier against internal root resorption in the presence of inflammation. This histological study done by Ricucci with others published in Journal of Dentistry in 2025. Internal root resorption is traditionally considered an inflammatory condition that causes a progressive destruction of dentin within the root canal space. The classic concept in endodontics state that the predentin and the odontoblast layer act as a protective barrier against resorption because clastic cells are unable to attach to unmineralized tissue. So internal resorption should occur only after loss or damage of predentin. The study was initiated after the authors occasionally observed multinucleated cells in close contact with the predentin in teeth with caries and partial pulp necrosis. These findings appear inconsistent with the long-established concept that predentin prevent clastic attachment and resorption. The aim of this study was to investigate histological changes associated with internal resorption, to evaluate the relationship between odontoclast and predentin, and to explore whether predentin can resist resorption in inflamed condition. And the hypothesis tested was that odontoclast may resorb predentin when it's affected by inflammation. The materials for this study originate from the histological collection of the first author over a period of 25 years. This collection included 265 human teeth with caries or restoration of varying depth. The teeth were extracted for reasons such as non-restorability, prosthetic needs, periodontal issues, or the patient preference not to have the tooth saved. They included 44 extracted human teeth with caries, bacterial penetration, partial pulp necrosis, and they exclude teeth with total pulp necrosis. The specimens underwent fixation followed by demineralization, and then the specimen had longitudinal serial sectioning of 4 to 5 micrometer in thickness. They used H&E staining for tissue evaluation and modified the Brown and Bren for identify bacteria. The analysis focused on resorptive lacunae, odontoclast presentation, and predentin integrity and inflammatory changes. The findings showed that resorptive activity was identified in 23 of the 44 teeth, which is 52%. Odontoclast were observed within house-shaped lacunae in areas of active dentin resorption. The most important observation was that in 12 cases, odontoclast were seen in close contact with residual predentin, as shown here in this figure. These findings were observed in teeth showing different degree of inflammation, from mild to severe inflammatory changes. The study also demonstrated bacterial colonization, biofilm formation, and acute inflammatory infiltrate and chronic inflammatory cells in affected pulp. Based on these histologic findings, the author suggested that predentin may not function as a completely reliable barrier under inflamed condition. The biological explanation remains speculative, and the author clearly stated that these ideas are mainly came from osteoclast biology because direct evidence for odontoclast is still limited. They proposed that inflammation may increase adhesion molecules, increase rank signaling, and elevate inflammatory cytokines such as interleukin 1 beta and interleukin 6. These changes may enhance odontoclast attachment and resorptive activity. Also, they discussed the possible role of MMBs, cathepsin K, also acidic microenvironment formation. These inflammatory changes may weaken predentin and allow resorptive activity to occur. They also mentioned that earlier studies may have missed these findings because they commonly used random histological sections rather than serial sectioning methods. This study was relied mainly on histological examination and light microscopy, which is limit these result. No molecular or functional experiment were performed, so the proposed mechanism remain speculative, and the authors emphasized that further molecular and microbiological studies are still needed. In conclusion, this study challenges the traditional concept that predentin act as complete protective barrier against internal root resorption. A histological observation showed odontoclast in contact with residual predentin and inflamed pulp, suggesting that predentin may not always prevent resorptive activity under pathological conditions. However, the biologic mechanism behind these findings remained speculative and require further molecular investigation.